Hello, and welcome to the Dr. David Hanley Osteoporosis Center's video presentation on osteoporosis and bone health, bone hygiene. This is the second in a series of 3 online videos. This video is for anyone with or without osteoporosis, providing information on how to protect your bones. If you've already attended our osteoporosis and bone health class in person, use this video as a review. If you think you would like to see a specialist at our clinic, you will need a doctor's referral. It is my pleasure to guide you through this presentation. Please note that it will not be possible to cover all topics in fine detail over the course of this short video. For further direction on healthy food choices or your individualized food requirements, speak to a registered dietitian. Before we start, we want you to know that the Dr. David Hanley Osteoporosis Center has no connection with any drug or supplement company. This video is for your education only and should not be taken as direct medical advice. You should always check with your doctor before making new decisions about your health. This video will provide information for postmenopausal women and older men with osteoporosis or individuals concerned about their bone health. Good hygiene for our bones is important for all of us, whether we have osteoporosis or not. There are things we can do to protect our bones. This presentation will go through good bone hygiene practices and provide you with information and resources to get started. Sometimes medications are considered to help people protect bones from breaking. Medications do not cure osteoporosis, but reduce the risk of breaking a bone by about 40%. If you are taking medications, we know that good bone hygiene will help your medications work at their best. This video will not discuss medications. See the third video of our series called Osteoporosis and Bone Health Medications for more information. Taking care of your bones means being physically active every day, eating a well-balanced diet, including vegetables, fruits, and whole grains, and getting enough dietary protein and calcium, taking a vitamin D supplement, limiting sodium or salt, caffeine, and alcohol, putting a plan into place for preventing falls, stopping to smoke, and taking medications as prescribed. This presentation will go through each of these factors individually and provide information and resources to help you protect your bones. It is very important to keep moving every day and do activities that you enjoy. There is no perfect exercise that can help everyone. We all have different abilities and needs. Exercises for osteoporosis should include strength or weight-bearing exercises like lifting weights and exercises using resistance, posture exercises such as standing and sitting with good posture and movement to support a strong core, balance training such as Tai Chi and dancing, and aerobic exercises such as walking, dancing, and stair climbing where your heart is beating faster and you are breathing harder. Always speak with a medical doctor when planning to start any new exercise program. We all need to do things we enjoy and recognize that we may need to modify these activities. The Alberta Health Services Alberta Healthy Living Program offers a free 8 to 12 week supervised group exercise class. All participants of this program are assessed individually prior to the group classes. Classes are all over the city of Calgary and neighboring communities. If you have a family physician or nurse practitioner, you can self-refer by calling 403-943-2584. You must have a chronic condition and the ability to walk to participate. Group supervised exercise programs are also offered for the Southwest Zone, Lethbridge, Southeast Zone, Medicine Hat, Brooks, and Central Zone, Red Deer. Osteoporosis Canada offers a video series, fact sheets, and booklet resources called Too Fit to Fracture to help guide people in their physical activity efforts. Take a look at osteoporosis.ca for more information, or contact 1-800-463-6842 for a free booklet called Too Fit to Fracture. If you have a personal trainer or are thinking about finding one, someone with further bone health education, such as Bone Fit certification through Osteoporosis Canada, may be helpful. The important thing is to find something that is right for you. And again, always speak with a medical doctor prior to starting any new exercise program. The second factor that supports bone hygiene is eating a well-balanced diet. Eating a well-balanced diet means different things to everyone. So what does balance look like? Eating a variety of healthy foods every day, including vegetables and fruits, whole grains, and protein-rich foods, will help give you the energy and protein your body needs to not only maintain a healthy weight, but function well. In 2019, Health Canada released their revised Canada's Food Guide, launching online tools and resources to support Canadians with healthy eating. Check out canada.ca/food guide for more information. Most of what you see and read about nutrition and bone health is related specifically to calcium and vitamin D. Although calcium and vitamin D are very important for our bones, we will discuss this next, so is eating a well-balanced diet. There is research that tells us that including vegetables and fruit in all, if not most, meals and snacks are associated with a lower risk of hip fracture. Choose whole grains. Did you know that whole grains and vegetables and fruits also contain calcium and other important nutrients for bone health? Protein is important for helping to build and repair bones. It also helps to maintain and build muscle mass and weight, which is important for bone health. Protein foods include legumes such as beans, lentils and chickpeas, shellfish, eggs, poultry, lean red meat including wild game, and lower fat milks, yogurts, kefir, and cheeses. Try and include some protein foods in all meals and snacks. So what's the story about calcium? Calcium helps to build bone in adolescence and keep our bones strong as adults. Did you know that 99% of the calcium in our body is stored in our bones and teeth? This means our bones and our teeth are our bank for calcium. Calcium is a mineral found in many foods. It is important to get enough calcium every day because if we don't meet our daily recommendations, calcium is taken from our bones. Other systems in our body need calcium to work. It's not just our bones that need calcium. So how much calcium do we need? Osteoporosis Canada recommends for those ages 19 to 50 years to aim for 1,000 milligrams of calcium every day from food sources first. For those over the age of 50, we should aim for 1,200 milligrams of calcium per day from food sources first. Once this target is met, there is no benefit to more. In fact, getting too much calcium, more than 2,000 milligrams of calcium a day in food and/or supplements, can be harmful to us. It is best to get your calcium from food sources first. Foods have important nutrients like protein, fiber, antioxidants, phosphorus, and potassium, for example. As mentioned before, you will find small amounts of calcium in many vegetables, fruits, and whole grains such as tomatoes, bananas, peppers, crackers, pasta, quinoa, and ancient grains like amaranth and teff. Here are two lists of food sources with 300 and 200 milligrams of calcium per serving size listed. Here is a list of food sources of calcium with about 100 milligrams of calcium per serving. Lists containing calcium and the amounts of foods can also be found on osteoporosiscalgary.com. We suggest you spend some time looking at your diet along with these lists and calculate how much calcium you are getting every day. Include both food and supplement sources such as multivitamins and antacids such as Tums. When you are doing this, it is very important to remember that not more than 500 milligrams of calcium can be absorbed or used by our bodies at one time. This goes for the calcium in both food and supplements. We need to spread out our calcium intake throughout the day. You may need a calcium supplement if you don't get enough calcium from food every day. Speak to your doctor or a registered dietitian about a calcium supplement. Please note that calcium and other vitamin and mineral supplements change the way some medications work. Your pharmacist can tell you the best times of the day to take your medications and supplements. What do we know about vitamin D? Vitamin D helps your body to absorb and use calcium. Vitamin D also helps bones and with muscle strength, which may reduce your risk for falls. We get vitamin D from our skin, from sunlight, from some foods we eat, and supplements. Osteoporosis Canada recommends supplementation of vitamin D year-round. For those aged 19 to 50 years, Alberta Health Services and Osteoporosis Canada recommends 400 to 1,000 international units per day of vitamin D supplement. For those with fractures, on bone medications, or those over the age of 50, Osteoporosis Canada recommends between 800 to 2,000 international units per day of vitamin D supplement. Your healthcare provider will recommend the amount that is right for you. Do not take more than 2,000 international units of vitamin D per day unless recommended by your healthcare provider. Taking too much vitamin D at doses of 4,000 international units per day or more may be harmful. Too much sodium, caffeine, and alcohol also can affect bone health. We will start with sodium, in other words, salt. When we eat too much sodium, sodium likes to grab onto calcium before it is flushed out of the body through urine. It acts as a diuretic. Limit the amount of sodium to 2,300 milligrams per day, which is equal to 1 teaspoon of salt. You can do this by eating less processed and packaged foods and reading labels to find foods lower in sodium. Restaurants often also serve foods high in salt. Check nutrition facts. Choose fresh foods and foods with no salt added most often. More than 400 milligrams of caffeine in a day can stop small amounts of calcium from being absorbed. Too much caffeine, just like too much sodium, also acts as a diuretic. Coffee is not our only source of caffeine. Some teas, cola beverages, energy drinks, espressos, and dark chocolate are also sources of caffeine. 1 cup of coffee, or 250 mils, is about 150 milligrams of caffeine. If you drink coffee, a general rule is to drink no more than 3 cups of coffee a day. Alcohol affects the absorption of important bone nutrients, and even small amounts can cause unsteadiness and increase the chance of a fall. If you drink alcohol, limit it to 1 to 2 drinks a day. 1 drink is 12 ounces, 355 mils of beer, 5 ounces, or 150 mils of wine, or 1.5 ounces, 45 mils of spirits. More than 2 drinks a day will affect bone health. 3 drinks per day or more is a major risk factor for fractures. To stop a bone from breaking, we aim to prevent a fall from happening in the first place. Let's look now at falls prevention. Falling is not a normal part of aging. Falling should not be a regular or everyday occurrence. We all need to be mindful of changes happening with our bodies and our environment, especially during the icy winters. We may be able to take some measures to protect ourselves from falling. You should seek help from your doctor when you've had 2 or more falls in 1 year, 1 fall where there is an injury of any kind, and if you're experiencing any disturbance in balance or how you walk, which could be caused by such things as low blood pressure, vertigo, vision and hearing changes, medication changes, foot or nail care, worries about falling, seizure disorders, or osteoarthritis. Steady on Your Feet is an education session offered by Alberta Health Services through Alberta Healthy Living program. In this session, you will learn about the risk of falls and how to decrease your chance of falling. Classes are led by physiotherapists and occupational therapists. Finding Balance from the Injury Prevention Centre is a website offering fall prevention information for seniors and health providers. Check out findingbalancealberta.ca for tools on how to help you identify if you are at risk for a fall and how you can prevent a fall. The next factor we will look at is smoking. Stopping smoking at any age is good for your bones. Smoking increases your risk of developing osteoporosis. Older adults who smoke are 30 to 40% more likely to break their hips than those who do not smoke. The good news is that fracture risk is reduced in those who give up smoking. This free web-based smoking cessation program, called Alberta Quits, is designed to help people who want to quit smoking or those using spit tobacco to find the support and tools they need. Check out albertaquits.ca. Lastly, it is important to take medications as prescribed. To get the benefits of medications, we need to take them as prescribed. For example, if it says take with water on an empty stomach and remain upright for 30 minutes, and we take the medication with coffee or orange juice, we will not get the benefits of the medication. Medications only work if they are taken correctly. In summary, whether we have osteoporosis or not, there are things we can do to protect our bones. Taking care of your bones means being physically active every day, eating a well-balanced diet, including vegetables, fruits, and whole grains, and getting enough dietary protein and calcium, taking a vitamin D supplement, limiting sodium or salt, caffeine, and alcohol, putting a plan into place for preventing falls, stopping to smoke, and taking medications as prescribed. This brings us to the end of our second video presentation, Osteoporosis and Bone Health, Bone Hygiene. Please visit our clinic website, osteoporosiscalgary.com, frequently for further information. If you have a referral to see us here at the Dr. David Hanley Osteoporosis Center, we look forward to seeing you. Here is our clinic address: Richmond Road Diagnostic and Treatment Center in Calgary at 1820 Richmond Road Southwest. We are located on the second floor. Stay connected by visiting us at osteoporosiscalgary.com. On our website, under the Patient Information section, we have a complete description on how to get to our clinic, where to park, and what to expect at your clinic visit. We encourage you to review our website before your visit with us. Thank you, on behalf of the Dr. David Hanley Osteoporosis Center, for taking the time to learn about osteoporosis and bone health, bone hygiene.